Hello and welcome. You're watching Money9 News. I'm Sakshi Batra. Well, the vaccination drive is set to expand to enable the inoculation of all above the age of 18 years from 1st of May. And to take us through the process of the registrations and how will the sudden rush be handled, I'm joined by the man of the moment right now, a very special guest joining in, Mr. RS Sharma, the CEO of National Health Authority, joins in. He's also the chairperson of the Empowered Group of COVID-19 Vaccine Administration. So thank you so much for taking out time for us. We know it's a very, very difficult and very, very, time-taking process that you are involved in completely. But we wish to understand from you how this entire process will be done. What are the changes one can really expect on the CoWIN platform from 28th of April, from the time the registrations begin?
Well, thank you, Sakshi, for having me on your platform, on your channel. As you know, from 1st of May, the liberalized vaccination policy is going to be implemented, which will mean that people of 18 years plus will be eligible for vaccination. And this time around, while there will be vaccinations at the government hospitals and centers, the scope of the private sector participation has been increased considerably, wherein they can directly purchase medicine from the manufacturers, vaccine from the manufacturers, and therefore the numbers are going to increase. Also, the fact that the people of 18 to 44 years are going to be added into this cohort. Therefore, the numbers are also going to significantly increase. We have made necessary changes in the platform to ensure that we are able to cater to a much larger number, and also we have made necessary changes to reflect the new policy guidelines, which is basically age, which is actually 45 years, has now been you will be able to customize it to 18 years, as and when the state governments decide to do that. So all those necessary changes have been made. Also, when the private sectors offer their vaccination, they will charge different prices for different vaccines.
Yes.
So therefore, the CoWIN platform will also reflect as to what is the price which the vaccination will cost to individuals if they actually get it vaccinated at those facilities.
Absolutely, sir. Very pertinent points made by you, and I have a question each for the all the points that you've made. In one, we know for a fact that no walk-ins will now be permitted. So, is that true for only 18 plus, or even 45 and 60 plus? No walk-ins will be allowed. Only pre-registrations will be allowed. And also, are we equipped to handle the volume of this 18 plus population, and also the people who've not got their second shot even now, both platform-wise and vaccination supply-wise as well?
So let me, answer this question in two parts. One is the walk-ins being allowed or not. So as you are aware, we had always recommended that people should go after getting, the appointments, because that makes the situation more orderly. Also, the crowd gets distributed. As you know, we were giving appointments in the forenoon, in the afternoon, and then we started giving
Yes.
appointments on a 2 hourly basis. So the whole idea is that when people go, they also find it very convenient to get vaccinated. Otherwise, everybody will crowd around in the morning itself and will have to wait till evening. So that way, dispersing the crowd throughout the day, that was also one of the objectives. Now, we have also said that in case there are vacancies available, and there is no, the capacity has not been utilized, then in the afternoon after 3 p.m. people can go and walk in. Now
Oh.
that will continue for people of 45 years plus. However, considering the fact that the number of persons of 18 years to 44 years is going to be pretty large, and if we allow walk-ins, it may happen that a center which has a capacity of 200, and you will have 2,000 people walk in and surrounding the center since the beginning itself. So I think from a management perspective at the local level, to ensure that there are social distancing norms, and also the fact that there is no crowding, etc., we have said that we will have only appointments, pre-appointments, and booking for 18 to 44 years. Now we will
Sure,
see
sir.
as the season goes, and if it becomes okay that allow walk-in for them also, that also we will consider. But being on the cautious on the right side, we decided that we should not allow walk-ins for this age cohort in the beginning.
All right, so I understood that point. Now we're also hearing that there may be a case now, unlike previously, that an option of a choice of vaccines may be available at one center, which means I can, as an individual, choose whether I want to get a Covaxin or a Covishield from 1st of May. And if that is the case, then will CoWIN as a platform speak to all the private hospitals to understand which vaccines are they individually also procuring? So as a registration person, like if I register myself, will I know which vaccine is available where?
Great question. Great question. Actually, what is going to happen is that the government centers will continue to vaccinate people, and there we will not really be declaring as to which vaccine is being administered there. So they will continue to work as before. However, in the private sector where you are going to have paid vaccinations, the private sector will not only be declaring as to which vaccine they are administering, also they will have to declare the price. So basically, they will have to say that these are the two vaccines which we are administering. These are the times for those vaccines. Maybe they can have two shifts, etc. And then they will give the price, and the CoWIN platform will declare that. Let me also make it very clear to you that it is the hospitals who will be onboarding on the CoWIN platform and making all these declarations as to which vaccine they are offering, what price they are offering, what timings they are actually vaccinating, what is the capacity of them. So all these information will have to be provided by the centers, because then and only then CoWIN platform will make it visible for people who are registering and getting appointment. It's like this: unless it's a platform, unless you declare the train timetables, people will not be able to make reservations. So
Right.
similar is the case here. The hospitals will have to onboard on the CoWIN platform, declare all the necessary information, even their geo coordinates, their addresses, etc. That is what is going to happen, and that will facilitate people to book appointments against those vacancies. Obviously, there
Okay.
will be certain hospitals, like for example, industry, or they are basically catering to captive audience of their own employees. They need
Hmm.
not declare the timetable for people or for public the vacancies, so that may happen. But normally all other private hospitals who are basically doing it as a service, public service, they will have to declare their vacancies and their capacities.
Absolutely, sir. I understood that, and most of the hospitals will now have to take that responsibility of giving out that information. That is imperative. Now, one more concern is on the infrastructure availability. Are these private and government hospitals equipped to handle the influx of more vaccines, also the international ones, which now will be open for the governments to procure, that need much lower temperatures and difficult and specific temperatures itself?
So the Ministry of Health and Health and Family Welfare have declared guidelines as to what are the necessary requirements for a hospital to offer vaccination. For example, they have to have a place for people to sort of sit there, offer drinking water facilities, etc. They have to have the facilities for catering to the adverse impact in case the vaccinations do create such reactions, etc. So that's another part. So there are multiple guidelines which have to be satisfied, and of course they have to report the adverse impact on the platform also, so that the government of India at a global and macro level knows the basic adverse, kind of adverse impacts which one particular vaccine, any particular vaccine creates and all that. So that part is well covered by the guidelines of the Ministry of Health and Family Welfare.
Sure, sir. Now, there's also still some confusion on the prices. Like you also said that most of the companies like Covishield and Covaxin, they have released their prices so far. But there is also news reports suggesting that perhaps now the central government is asking these institutes to lower the prices. So what is the clarity that people have going in for the vaccination from 1st of May?
Well, I will not be able to answer that question because we are merely maintaining that platform. Only
Sure.
thing is that when the private hospitals declare that this is the vaccine we will be vaccinating and this is the price, that
Okay.
is what will be visible to the people. With regard to the negotiations or the prices or lowering, hiring, that part I don't know. Only
Hmm.
thing I also know is that certain state governments have said that they will be offering 18 years plus on a free basis. So
Yes,
that
sir.
part, this is the platform is customizable. So each state will be able to basically customize the age for which they are offering the free vaccination at government facilities. So that part is there. So suppose some state wants that I will offer free to 18 years, some other state says that I'll offer it to 25 years free, that they will be able to make those changes in the platform.
Okay, sir. One more question that I have for you, sir, is that there is some talk of in between industrialists and corporates on Twitter. We are seeing on social platforms that there are some companies who would want to, as a philanthropic step, also want to contribute in paying for the vaccines for those people who cannot afford it. So, will the platform look to innovate and put some additional points so that people can pay for those people over there? Is that a possibility?
Well, platform really has no information about the payment part. Payment
Okay.
part, is not a part of the platform. But today, as India is having a huge digital payment, infrastructure. We had recorded 4 billion, digital payment transactions on UPI in the month of January this year. So it's everybody is making payments on these apps, whether it is phone pay, Google Pay, or Paytm, and all these kinds of applications. So I don't think the payment is really going to be an issue in terms of how you pay, and we have not kept that as a part of the CoWIN app.
Okay, so we also have some audience questions, one or two audience questions that they would want to directly speak to you through our platform. Let's just quickly see that. Khushbu Tewari has written to you, sir. She wants to know, can we still register 4 people with one number, or does the process remain same? Any documentation needed to be carried now?
Absolutely important question, Khushbu. I think we will. The process remains exactly the same. 4 people can register against one mobile. However, let me also give you the information that each of the 4 persons is completely independent entity, which means that one person can use Aadhaar as one of the documents, another person can use driving license, another person can use the election photo ID card, and even those 4 persons can have independent appointments at different places on different dates. So they are just four in the sense of having a kind of sort of portal or a platform, so to say, or a dashboard for those 4 people. But they are completely independent and free to go. Somebody can go for a paid facility, somebody else can go for free facility. So all kinds of freedoms exist. Obviously, you have to now indicate as to what kind of document will you be bringing to the center, and that
Okay.
the name and gender and the age has to be according to that document, so that there is no problem. Many times people come and say my name is not entered properly in the certificate. Now your name is not entered properly because you did not enter your name properly. So you should be careful enough. The only information which the CoWIN portal asks you is what is your name and what is your gender and what is your date of birth. That's all. And these three informations you should be careful enough to actually enter these three informations correctly.
Absolutely, sir. One more question that we have is from Ankur Sengupta. He wants to know that is CoWIN app secure at all to share my personal details on that platform?
Well, thank you, Ankur. That's also a very important question. The only thing which I can say is the personal information which we are getting on the CoWIN platform is your name, right? Is your gender, and is your date of birth. Now, Ankur, you have disclosed your name, right? And your name is certainly not a very sensitive private information. Your gender also, I suppose, is not. Your date of birth, maybe, yes, you are right. So basically, first of all, we are not collecting any kind of personally sensitive data. Of course, your mobile number will be there, but despite that we are not collecting any personal information, sensitive personal information.
Sure.
We will ensure that your information is absolutely safe and secure. That you can be
Sure.
assured.
Hope that answers your question, Ankur. Tina's question is next, and she wants to ask from you, sir, that how long can we delay the second vaccine given that hospitals are already crowded with the patients? So those people who have already inoculated with one dose, can they wait a little longer so that there is a lower rush and then they can go for it?
Well, Tina, I'm not a doctor really, so I will not be able to answer that question. There are advisories which keep on coming from time to time from the Ministry of Health and Family Welfare. and I think you should go according to them. With regard to, I think there is a gap, there's a window. For example, some vaccines are saying 4 to 8 weeks or 6 to 8 weeks. So at least there's a 2 weeks window in which you can go, and I'm not sure what happens if you are not able to take that window, maybe a little couple of days later. I don't think it creates any problem, but nevertheless I'll not be able to answer that question because I'm not really a qualified person for that.
Right, so thanks for addressing those audience questions. But one more last message that I want to, have you to say to all our viewers watching you from this platform, because there is a sense of nervousness right now among the people who are just anticipating whether they will get a chance to get inoculated from 1st of May, keeping in mind that there will be huge rush over there. How will the platform manage it technologically? Will it be able to support the rush? And also outside, what is your message there to people who are still in this kind of nerves?
Well, I think Government of India has declared a liberalized policy, and I think we are committed, all of us are committed to ensure that vaccines reach everybody. There's no every eligible person. So I think you should be rest assured. Only thing is that, it may happen that everybody may not get vaccinated first day, second day, third day. So there may be, obviously the numbers will be finite. It can't be an infinite number. But at the same time, I'm very sure that the policies which we have in place will be able to ensure the inclusive coverage of vaccination of our population. Thank you very much.
Thank you so much, Mr. Sharma, for giving us your time and explaining to us the entire process, how it will unfold from 1st of May. All the very best to you. Hope we will be able to overcome this situation that is at hand, all together, united in it. Thank you very much for speaking to us. And with that, we wrap up.
For having me on your channel. Thank you.
Thank you so much, sir. It's been a pleasure speaking to you, as is always, sir. And with that, we wrap up this edition of Money9 News. Mr. Sharma talking about very, very pertinent and important points for all our viewers who have a lot of questions regarding how the process will be undertaken from 1st of May with regards to the CoWIN app registrations, and also how do they handle the influx of these kind of rush that happens from 1st of May of 18 plus at your nearest centers, the infrastructure issues, the kind of vaccines that will be available, the pricing, all of that has been spoken up, and you can just revisit this interview going on our website and our platforms as well if you've missed the first part as well. Thank you very much for joining.